Welcome to the video, The Great Dodo Bird Debate, an inside look at the controversies about how psychotherapy actually works. My name is Dr. Stephen Bacon. I'm in private practice in Santa Barbara, California, and I've spent the past decade writing books and investigating the topic of how psychotherapy works. Supporting the provocative conclusions. In the previous video, numerous provocative claims were made about psychotherapy, including training doesn't work, therapists don't get better as a result of experience, and psychotherapy techniques lack inherent power. This video and the next two research-centered videos will examine the research and logic behind these conclusions. Literature reviews like these tend to be a bit technical and dry. Hence, those who dislike this sort of approach can skip to video 5, Social Constructionism, explaining the provocative research results. While that is certainly your choice, understanding the research foundations should provide an advantage in terms of understanding the new ideas. A brief history of explaining psychotherapy effects. Once it was established that psychotherapy was generally effective, the focus shifted to explaining how and why it worked. This was particularly pressing because psychotherapy was divided into different schools. For example, cognitive behavioral versus psychodynamic versus humanistic. Each school had completely different explanations for psychotherapy, personality, and psychopathology. In addition to having different theories, the different schools developed and used very different techniques. Common versus specific factors. In an attempt to sort out these enormous divergences between schools, psychotherapy theoreticians suggested that therapy worked because of common factors and specific factors. Common factors were strategies that were common to all schools of therapy. The most well-known common factor is a relationship with a wise and caring person, but other common factors have been suggested as well. Specific factors were factors that are unique to each school. Examples might be the school's underlying philosophy or the specific techniques used by each school. Dodo bird theory. This model worked well until the 1970s, when a team of researchers discovered that a compilation of all the outcome studies, a meta-analysis, revealed that all the schools of therapy got equivalent results, and no school was better or worse than another. Here's a quote. "The conclusion of most, but not all of these reviews is similar to that drawn by Liborski, Singer, and Liborski, who suggested a verdict similar to that of the dodo bird in Alice in Wonderland. Everyone is one, and all must have prizes." However, meta-analytic methods have now been extensively applied to large groups of comparative studies, and these reviews generally offer similar conclusions. That is, little or no difference between therapies. The provocative implications of the dodo bird. This postulated equivalency creates an enormous potential problem. If techniques have inherent power, different techniques and different systems ought to generate different effect sizes, as one system or technique corresponds better to reality, and hence works better. Can we really believe that the inherent power of all these different systems and techniques are coincidentally exactly equal? Since that coincidence is unbelievable, Dodo bird implies that there are no specific factors. The end of psychotherapy as science. The direction of our field, our evolution, is based on the idea that our techniques have power, that our understanding of psychopathology is advancing as we better understand each diagnosis, and our underlying systems and philosophies are progressively better estimates of reality. The epitome of this strategy is the evidence-based technique, a therapy technique that is based on research and is designed to fit a particular diagnosis and set of client characteristics. Accepting that psychotherapy techniques are rituals or placebos would destroy all of our assumptions that psychotherapy is a scientific field that works like medicine. Attack on the dodo bird. To protect the current paradigm that explains how psychotherapy works, it is necessary to disprove the dodo bird theory. The initial attack has specific factors adherents, pointing out that there are literally hundreds of studies that have found one technique superior to another, at least in certain circumstances. Moreover, dismembering studies that attempt to attribute effect sizes to causal factors, report that about 15% of the effect size of therapeutic change is due to specific factors. Defending the bird. The dodo bird adherents respond by pointing out that multiple meta-analyses have supported the dodo bird finding. They argue that many of the studies that show superiority are marred by poor experimental design. Finally, they suggest that the rest of the alleged superiority is due to allegiance factors. Allegiance factors occur when the therapists in a given study prefer one method over another. Arguing to stalemate. Neither side has been able to convince the other. Scott Miller, an expert on the dodo bird controversy, points out, quote, "The hope that with the right research design or line of investigation, a clear victor will come forth is, to put it bluntly, akin to an alchemist's optimism. After 50 years and a massive expenditure of time, effort, and money, had one side or the other been right, lead would have been transformed into empirical gold long ago. Few have been sufficiently swayed to give up their claims or view of the evidence." The good news, a simple solution. The literature on training and experience effects provides a resolution. More experienced therapists know more techniques than the inexperienced. Moreover, they have practiced them more assiduously. If techniques have inherent power, then there will be an experience effect on outcomes. Training effects are even more clear. The untrained do not know psychotherapeutic techniques, and the trained know a significant number. Similarly, the lightly trained know and have practiced fewer techniques than the relatively highly trained. If techniques have inherent power, the more highly trained professionals will achieve better therapeutic outcomes. The next video reviews the training and experience literature. Subsequent videos examine the implications of the collapse of the extant psychotherapy paradigm. And later video focuses on enhancing therapeutic outcomes and on using this material for personal growth.